Hello and welcome back again to Thrive Live, presented by Energy Incorporated. This activity is sponsored in part by the DC Department of Behavioral Health and our state opioid response to the opioid crisis. We are so glad that you're with us today. We are going to talk, we've been talking the last couple of times with people sharing their real stories, real people, real stories, real solutions, right? But this time I want to back up just a little bit. I want to share some information to you so you can understand why this is so important and why we have chosen to take this format and this forum to educate our community, to empower our community, and to engage you in ways that we can help save lives and end the opioid epidemic in our time. So I want to share with you about the opioid crisis, some new information that's been going on in the District of Columbia primarily. We'll talk maybe a little bit about things happening around the country in comparison, but we're just going to talk for a little bit about this. In this video, we encourage you to watch, to share, to like, and if you're interested in joining us, you can check us out on our Facebook page, on our YouTube channel, and on our Instagram and TikTok even. And you'll also be able to engage us. You can email us at energyincorporated@gmail.com. That's INNERGY incorporated, all one word, at gmail.com. And we'll be happy to come to your organization, to your facility, to a group, to your family, and share opioid information, education, and also naloxone, the medication that helps to reverse opioid overdoses and save lives. And that is really, people, what this is all about. It's really about saving lives. So I'm going to share with you right now some new information that we've been collecting on our own, in addition to the information that we get from the DC Department of Health and the DC Department of Behavioral Health. So we're going to talk a little bit about this opioid crisis in DC. And again, this activity is sponsored by the State Opioid Response Grant through the DC Department of Behavioral Health. We are so grateful to be a part of this cohort of people doing this work around our wonderful, wonderful state of the District of Columbia. So we're going to talk a little bit about some recent data. We're going to talk about little racial disparities, the synthetic opioids that are on the market and coming out right now, and some of our government interventions. This crisis has been disproportionately affecting Black and Brown communities, but particularly Black communities in the District of Columbia for quite some time. This particular epidemic also is exacerbated or grows even bigger and harder and is more insidious because of the presence of fentanyl and other forms of synthetic opioids that are out on the market. Let me pause here for a quick second and share just a little bit while you look at some of this information on the data. Opioids are a class of drugs that are used to help mask the symptoms of pain in our bodies. It does not mean that it is a cure to pain. It does not make pain go away. What it does, it blocks the opioid receptors, it attaches to the opioid receptors that allow you to alleviate or have the masking effect of not experiencing pain. So if you've ever had a tooth extraction, maybe a minor surgery or even a major surgery, any kind of major accidents of any sort, you're usually given some sort of opioid for medication that will help you to make it through the pain, because pain can be excruciating and pain can cause you to die because you can just be overwhelmed by the sense of pain in your body. So in our bodies, we have pain receptors, and the opioids bind with those pain receptors, and they help to reduce the impact or the feeling of pain. Again, it does not mean that the thing that caused the pain is gone. It just means you're not feeling it as much, which is why we tell you not to operate heavy machinery or drive or other things like that when you are taking an opioid, because you will have a delayed reaction to most things, and you also don't feel things that are happening because your body's not feeling the sensation of pain. So you can really injure yourself significantly because you don't feel it happening, potentially. So the opioids work in that way. And an overdose is when someone takes more opioids than their body can handle and then their body should have at any one time. And it causes them to lose consciousness, stop breathing. It depresses the respiratory system so that ultimately, if it depresses it enough, you stop breathing. And then that causes the obvious idea of death, right? And not just an idea, it causes one to die. And so in this context, we are putting out Narcan, which is a brand name for the naloxone, which is a medication that interrupts the binding of the opioid to the pain receptors, and it blocks it so that it doesn't do that. It doesn't bind. Therefore, you don't get the effect of the opioid, and therefore it reverses the opioid addiction. So since January 2017 and October 2023, we have data that talks about the impact of this drug and the situation in the District of Columbia. There have been a significant number of deaths that have occurred in Washington, D.C., according to our chief medical officers and examiners' offices. 96% of these deaths have involved fentanyl being involved in the drug or the medication or whatever it is that someone is taking that has caused them to overdose. According to the CDC, the national average has had a decline in 24% from October 2023 to September of 2024, but our data is still not yet in, but our numbers have continued to be there. Now, there is multiple substances that can be in the drug supply in our communities, and that includes various kinds of synthetic opioids, semi-synthetic opioids, and naturally occurring or non-synthetic opioids, so just derivatives directly from the plant. But there are also other medications that are out there that are finding its way into our illicit drug supply. And xylazine, a veterinary tranquilizer, is now another drug that is finding its way into the supply in our communities. And so it's really important that you really help people understand what they are taking into their bodies and what you're doing. Again, we don't believe in judging people. We don't believe in causing anyone to have any particular argument around their drug use or substance use or any abuse of substances. We want people to get the help that they need. We want them to get access to life-saving medications. We want them to get access to community supports that will allow them to alleviate the reasons why drugs may be a factor in them coping with life and with what's happening, right? It is a very, very difficult situation once you have an addiction to be able to overcome that. And so there are often reoccurrences that happen. And we are working to mitigate that, to eliminate that, to get people in the right kinds of programs and treatments that allow them to live healthier and happier lives. There's a disproportionate impact of the opioids in our communities, and in between 2014 and 2020, there were an increase of 485% of deaths among Black residents, and the increase among white residents was only 81%. Now, any increase is a bad increase. We don't want increases in any of our communities, but there is a huge difference in terms of the way that this particular drug is impacting folks here in the District of Columbia. Black residents made up about 84% of our opioid-related deaths in 2023. Contributing factors included lots of problems with the systemic healthcare disparities, reduced access to treatment in some cases, and a lot of socioeconomic challenges that our community members are facing, right? Targeted interventions are the things that we need to address these disparities, especially racial disparities in prevention and in treatment services, which is why we're doing this work. We want to be a bridge in between those areas where there is a lack of education, a lack of access to life-saving medications, and a lack of awareness in the community and how we support and work with each other. The rise of nitrazines, synthetic opioids, significantly more potent than fentanyl, are causing a significant concern in our area. Many of the users that are having these medications, these other drugs that are mixed in with their drug supply, are unaware that they are there. We do offer, in addition to the naloxone and Narcan, we do offer fentanyl test strips, so you can see what kind of fentanyl is in your drug if you're using it, so that you're aware of it, because fentanyl is infinitely more potent than opioids on non-synthetic opioids. And xylazine, and non-opioid sedative, is being mixed with fentanyl. So this is a non-opioid sedative, but it's used as an animal tranquilizer, being mixed in with the medication. So just understand that fentanyl opioids are already depressing the system. They're already a sedative. And if you add more sedative to it that is also not opioid related, then our medication, naloxone, only works on opioid and opioid related medication. So it will not reverse an impact of something that is laced with something other than an opioid. Although fixing the part with the opioid can still be helpful. Naloxone, or our brand name Narcan that we use here in DC, remains the most effective treatment against opioid overdose and helping to reverse an opioid overdose. But again, it does not reverse the effects of other drugs because it does not act on those other drugs or those receptors in our body. DC, we've got a program here called Live Long DC, and we hope that you've heard about it. If you haven't heard about it, you can find out more about it by calling the Access Helpline, and that information is going to appear on the bottom of the screen here, along with being able to reach out to our organization, Energy Incorporated. We'll get you connected to ways that you can text Live Long DC and get more information so that you can be aware, get access to Narcan and other kinds of services as well. Live Long DC, we're working through this program to reduce the opioid-related deaths by expanding the availability of Narcan in our communities, by increasing the numbers of people that have it, that can teach about it, that can share it, that can make sure it gets into your hands. We want to increase the access to medication-assisted treatment programs and also continue to enhance our harm reduction programs that allow people to move at a pace that makes sense for them as they work to increase health. We're also working to increase our ability to advocate and be advocates for our community, to provide the right kinds of legislation with our government, as well as the right kinds of programs and support services that are needed out there to be able to help people along the way. Now, this is information that kind of can be helpful to us. It's not the greatest in terms of motivation for why we need to do something different. But let's just talk about the impact, the economic and social impacts on our communities. There's a estimated $1.5 trillion in additional expenses that opioid crisis is costing the U.S. And so you can imagine what those numbers are here in D.C. It's a 37% increase from 2017. There are increased healthcare costs, emergency rooms, overdose treatments, long-term rehabilitation issues. There are lots of ways that this is causing us to have more and more problems. It affects families. It affects families at every level, from our babies to our seniors. And it affects the loss of our workplace productivity. People are not able to work, or not going to their jobs, or are unable to effectively do their jobs, right? Which costs more money. Also, potential harm on the job, potential injuries, and other kinds of things, and the impact that it has on everyone else. And then we talk about the different levels of the social stigma, social issues, and our way that impacts the morale of our communities and the way that we're able to function. There's a strain on society in general as people are not able to function to the best of their ability. And that also can lead to higher criminal justice costs associated with any related arrests, incarcerations, and other kinds of problems like that. So this problem, the opioid crisis, remains very, very severe in Washington, D.C., particularly among Black communities, particularly among males between the ages of 40 and 70, particularly in wards 7 and 8 and 5, where the majority of our, the larger numbers we're seeing extremely high, and also to some degree in our unhoused communities as well. So all of these are concerns and issues that we're trying to address across the board. And it does not mean that the other wards do not have this epidemic. They absolutely do. It does not mean that other people do not have this epidemic happening. They absolutely do. This is a crisis for all of us. This is an all hands on deck conversation about how we change the nature of what's happening in our collective communities around the opioid crisis. We are continuing to find ways to invest in harm reduction, treatment accessibility, and policy reforms as they are necessary to do. We want you to be aware, again, that there's a rise of new synthetic opioids that are being added to our drug supply, as well as other drugs that are non-opioids that are being added to the drug supply that only exacerbate the problems and the issues that are happening when you are taking and using an opioid. We're working to build collaborative efforts between our government agencies, healthcare providers, and community organizations like Energy Incorporated and the Department of Behavioral Health, DC government, and SAMHSA, which helps to support these kinds of efforts that we are doing to make life better for all the members of our community. We hope that this particular presentation has been helpful for you to give you a basics of understanding what's happening, what an opioid is, how you can do it, and how you can revert, how you can access a life-saving medication. Check us out in the future so you can see us with a presentation exactly on how to use Narcan. Join us for one of our in-person sessions in the community. You can check us out on our website, www.energyincorporated.org. You can call the DC Access Helpline. You can email us at energyincorporated@gmail.com. That's INNERGY incorporated@gmail.com. Check us out on Facebook, on YouTube, on Instagram, and on Twitter, and you will be able to access any of the information that we have. You can watch some of our other podcasts on our channels as well, and share it with your community, as we are looking for people like you who are willing to partner with people like us to help make the community better for all of our people. Have a great day, and thank you so much for being with us. This information is provided, and the resources are here to share with you some of where we've gotten our statistics and our information, and you're welcome to take a look at that, screenshot that if you want to, or just push rewind and look at it again so you can gather the information that you would like to have as well. Thank you so much for being with us, and we hope that you will join us again, and look out for our next podcast coming soon. Have a wonderful day on purpose. Remember, we are here with Thrive Live with real people, real situations, real stories, and real solutions. I'm going to get that right one of these days, right? Thank you. I'm Reverend Darryl Moch, and I am so glad that you're here to be a part of this and that you're watching this. Remember, real people, real stories, real solutions here at Thrive Live. Have a wonderful, wonderful day. Take care of yourselves and each other. Each of us can save a life every day if we want to.